All right, now it's on the screen. Okay, so you guys have heard all day about the two inflammatory bowel diseases, ulcerative colitis and Crohn's disease. And the way that we think about symptoms in these diseases is really based on where the inflammation happens. So the symptoms depend on the location of the inflammation and the presence of complications. So in ulcerative colitis, this almost always involves the rectum. That's that very last portion of the intestines. And because of this, the major symptoms related to ulcerative colitis are diarrhea. Patients almost always have bleeding. They can have a lot of urgency because there can be spasm in that last portion of the intestine that gets inflamed. There can be abdominal cramping. Because of bleeding, they can have low iron or anemia, low blood counts. Nausea can happen, particularly when people are having, in the middle of having cramping from bowel movements. And patients can lose weight, and they can lose weight for a number of reasons. One reason is they may limit the amount that they eat because they're afraid it's going to cause them symptoms. And secondly, there's a catabolic process where the body is actually using a lot of its energy in order to create this inflammation in the intestines, and that is being diverted away from protein building and weight building. In Crohn's disease, we can see very many similar symptoms if the distribution of inflammation is the same. So some people have Crohn's disease in their colon that looks a lot like ulcerative colitis. Other patients may have disease in the small intestine, and this gives us some different symptoms. So here, we may have more watery diarrhea that's related to poor absorption. We may have vitamin deficiencies like low iron, low B12, low vitamin D. Again, patients may have weight loss because the body is using a lot of its energy to create this inflammatory response, but they also may have weight loss because they're not absorbing things well in the small intestine. That's the major place where nutrients are absorbed. They may have nausea because the small intestine is inflamed. And again, they may have abdominal pain, and abdominal pain tends to be a more common component of Crohn's disease than it is of ulcerative colitis. And that's because the inflammation in Crohn's disease goes through the entire wall of the intestine and hits the outside of the intestine where we have a lot of nerve receptors that can be very sensitive to pain. We also can get complications, particularly in Crohn's disease, where the disease causes this inflammation through the wall of the intestine. And this can lead to narrowing of the intestine called strictures. That can cause bowel obstructions, so patients can get obstructive symptoms related to that, can cause nausea, vomiting, and abdominal pain commonly. And they can get fistulas. This is where there is inflammation across the wall of the intestine that causes a hole into another organ system. So these can happen around the anal area, and they can also happen inside the body where the bowel can make a hole to another intestinal segment, or it can actually spill the contents of the intestines into the abdominal cavity and create an infection within the abdomen. And we can see fevers if patients have infections related to these fistulous complications in Crohn's disease. But we also know, and I think most of you in this room know, that inflammatory bowel disease is really a whole body disease. It doesn't only affect the intestine. And what a lot of my patients talk about with me is not only these symptoms related to the intestinal inflammation, but they may have things like anxiety and depression that come along with their disease, stress, pain, sometimes pain in other parts of their body, not just their abdomen, their joints. They may have fatigue that can be very severe and debilitating, and they can have difficulty sleeping. And this is not an exhaustive list, but just to say that the symptoms are happening outside of the bowel. When we think about symptoms as physicians, there are symptoms that can look the same, but come from a different underlying root cause, okay? So we see the symptoms are kind of at the surface. That's what you're experiencing as a patient. That's what you may tell your doctor. But the root cause, just based on that symptom of diarrhea or pain or bleeding, may be different. And what we really want to understand as a first step to understanding and really treating symptoms is Is this the inflammation from the disease, from the ulcerative colitis or Crohn's disease, that is causing the symptoms? Secondly, if it's not the inflammation, is there a mechanical problem? So this might be something in Crohn's disease like a stricture, a narrowing of the bowel that's causing a lot of symptoms, or a post-surgical problem that may be causing symptoms. If it's not one of those two things, could it be something that's not related to the inflammatory bowel disease? So I think commonly you'll see your doctor check you for an infection called C. diff when you have a flare in your symptoms. So is there something else that could be going on that might mimic the symptoms of your inflammatory bowel disease? And then sometimes we don't find anything. And I say here an unidentified cause. Your doctor might call this irritable bowel syndrome. That can happen on top of your Crohn's disease or ulcerative colitis. But a lot of times patients have symptoms that go on and we just don't see, we can't see the cause for it, but it doesn't mean that those symptoms aren't bothersome or shouldn't be treated. So when I was thinking about how to put together this talk, I sort of thought about my own approach to symptom control with my patients. I think as physicians, we're very good at trying to figure out what the root cause is and trying to treat the root cause. So that's the first thing we do, right? We see, is this inflammation related to the inflammatory bowel disease? Is there something else going on that might be treated? And when we find something, we try to direct our treatment and our treatment of the symptoms towards getting the inflammation better. So that might be changing up the medication or treating the overlying infection. But what most of you know is that even when we're really quick to identify and treat when something is going wrong, sometimes those symptoms persist. They can persist while we're in the process of finding the new medication that may work, and sometimes they persist even when we have patients on a good treatment plan and we see that the inflammation is getting better. So when we go beyond what we're really good at as physicians, we get into this other tricky part. And this is a place where it's really helpful to develop a team of people around you to help you become the expert in your body, okay? This is where we do some experimentation to try to get some resolution to the symptoms that you may be having. What you're going to hear in the next couple of slides when I'm going to talk about some specific symptoms is that I'm going to give you a list of some things you can try, you can talk about with your doctor. They're really just a starting point. We don't have a lot of data that shows us exactly how we should treat symptoms in inflammatory bowel disease, and everybody's body is a little bit different. So I would encourage you to become the expert in your own body. And this means approaching this kind of like a scientist, trying some things, doing them in a very controlled way, writing down what you're doing, making those changes, and then seeing what works and seeing what doesn't work. And this can be somewhat frustrating, and I think it's very easy during this process of really trying to understand the way that your body functions to get stuck when things don't work, to feel like nothing is working or things are failing. And this is, again, where it's really helpful to have a team of people behind you, a coach, a registered dietitian, a mental health care professional, your doctor team, to help cheer you along as you're going through figuring out what works for you and what doesn't work for you. Because after every failure, you're moving on to figuring out what might be working. Last, I just want to say that I have become a big fan of using mind-body techniques in patients with inflammatory bowel disease because they help us change the focus of our symptoms. And I'm going to talk a little bit about this in this lecture as it goes on. But I encourage people to be open to some mindfulness techniques that may help you just change the experience of the symptoms. So with this multi-pronged approach to dealing with symptoms, I have been creating at OHSU a multidisciplinary integrated care team. And this is really a way to surround patients with a whole bunch of people who can help in different aspects of their care and who can work together to support them in this journey to figure out how to treat their disease, treat their inflammation, treat their symptoms, and treat them as a whole person. There are many centers around the country that are creating these multidisciplinary integrated care centers. At the center of it is really a health psychologist, dietitian, a physician, and then lots of other integrated services that may be helpful for certain patients. And studies coming out of centers such as Mount Sinai have really shown that having a health psychiatrist and a team of people working together can reduce actually can help people in their quality of life and can reduce hospitalizations for certain patient groups. So we know this can be very beneficial. Not every medical team has this kind of a center available, but I would encourage you that you can seek out and surround yourself with your own team of people helping to cheer you on. Those can be family members. You can seek out some of these other health professionals in your own life. And I think what you'll see too is that more and more there are going to be some digital platforms that are going to be available that can help supplement what you have in your own hospital care team. So I want to go through some specific symptoms and how we can kind of think about this and troubleshoot. You don't have to write any of this down. I'll have my slides available for you. Okay, so one common symptom patients with inflammatory bowel disease have is diarrhea. Again, we're always looking for what is the cause. So if there is underlying inflammation, we want to treat that, and that will be working with your doctor to find the right medication to treat or the right diet to treat you. We're going to rule out infection like C. diff, and then if we don't find inflammation or infection, we're going to be looking for other potential causes of diarrhea. Those could be things like bile acid diarrhea. This happens commonly in people who have had surgeries of the small intestine, things like bacterial overgrowth. There are also medications that can cause diarrhea, so really doing a thorough evaluation of what you're taking. And then you could work with your doctor to try some different anti-diarrheal medications. Again, not everybody's going to be right for every medication, but things like psyllium, which is a fiber supplement, loperamide or Imodium, atropine diphenoxylate, which is Lomotil, cholestyramine, are examples of medicines you might use with your doctor's approval to try to reduce diarrheal symptoms. There are also some dietary things you can do, and again, this is going to be experimentation. I know Dr. Susskind talked this morning about diet, and I'm not talking about diet here to reduce inflammation, but really just learning how to figure out for you as an individual what dietary things might be helpful to play around with to see if you can improve your diarrhea. And this is going to require some trial and error. I really do recommend that people work with a registered dietitian. They can use a food diary. You can try to notice if there are specific food triggers, and I've given some things that one could look for, like gluten, fatty foods, high fiber foods, dairy, and things that have high sugar. There are some diets that have been shown to be helpful for irritable bowel syndrome, which some patients with inflammatory bowel disease also find helpful, like the low FODMAP diet. The BRAT diet, which is bananas, rice, applesauce, and toast, can be helpful. We really use that in the short term just to kind of get people through. We don't want to use that in the long term because of needing to have appropriate nutrition. People can try eating small, frequent meals, avoiding activity after meals, which can get the bowels moving, and then limiting drinks that are high in fructose, caffeine, alcohol, carbonation can be helpful for some patients. And again, these are just starting points where you can start to look at what might be helpful. And then also, if you're having diarrhea, really making sure that you're hydrating, eating foods that have some salt in them and some potassium to replete some of your electrolytes. Urgency and incontinence are other symptoms that are quite frequent in inflammatory bowel disease. Again, we really want to understand why people are having these symptoms. If there's rectal inflammation, it's really important to treat the rectal inflammation, and this might be done with suppositories or enema therapy. Sometimes patients can have damage to the anal sphincter that can cause this, and again, it's really important to understand that with your doctor to see if there are particular treatments that might be right for you. Again, medications that can treat the rectum if the rectum is very inflamed. Medicines that reduce diarrhea can be very helpful. And then pelvic floor physical therapy is another thing that I think is sometimes overlooked, because this physical therapy can really help you to strengthen these muscles and improve rectal control. A little plug here too for the We Can't Wait app that the Crohn's and Colitis Foundation has put out. And that is if you do struggle with this, it's an app you can put in your phone, and it can tell you where the nearest public restrooms are, or restrooms that have been vetted by people who are sympathetic to the need for medical use. Constipation, this is one we don't often talk about, but can be a symptom of inflammatory bowel disease. Again, we want to make sure we understand why people have constipation. Sometimes proctitis or disease right in the rectum can cause constipation. Also, people who have narrowings in the bowel from Crohn's disease can present with constipation. And again, it's important to treat the underlying cause there. So treating inflammation, treating a stricture, which might be done surgically or through endoscopy. And then there are other medical causes of constipation that you should talk about with your doctor, like testing for thyroid disease. We try to have people not hold their stool in or strain while they're on the toilet. And then medications can be used in consultation with your doctor. Again, things like Miralax, polyethylene glycol, which is a very, very safe medication and can be titrated. Psyllium fiber supplement is not for everybody. Again, if you have strictures, probably not a great medication for you. But again, talking to your doctor about what both over-the-counter and prescription medications might be helpful for your constipation. Gas and bloating, again, very common. It can be actually a medical problem related to poor absorption of nutrients. It can be the sign that there's a stricture or a narrowing. So again, really important to rule these things out with your physician, ruling out small intestinal bacterial overgrowth, which can be another cause of gas and bloating. And then if you've ruled out those things, again, doing a food diary and seeing if there are potential triggers. I've written some of the gas-producing foods here, like beans, cauliflower, whole grains, sometimes high-fat foods can cause a lot of gas. And so, again, being your own detective and trying to figure out which of these foods might be a problem for you. Some patients find that the low FODMAP diet, again, this is a diet that's been shown to be very helpful for irritable bowel syndrome, can be helpful. Cutting out dairy and lactose. And then there are some over-the-counter medications that sometimes can be helpful, like simethicone or Beano. Eating small, frequent meals slowly and avoiding gulping air and avoiding carbonation. So again, I think this is these are just some things to start on, but again, being a detective for yourself and trying to figure out what may be helpful in terms of managing these symptoms. And then nausea. So again, getting at the underlying cause. Is this related to ongoing active inflammation or a narrowing of the bowel? We want to make sure we're treating those if those are present. And then nausea can be related to some of the medications that we give in inflammatory bowel disease. So things like methotrexate or sometimes azathioprine. So doing a really careful medication review with your doctor can be very helpful. And then again, doing some detective work for yourself, trying to potentially eat small, frequent meals, eating slowly to allow your stomach to empty, avoiding high fat and high fiber diets can be helpful because those can delay the stomach from emptying. Alcohol can sometimes be a trigger for nausea. Trying to separate the liquid and solid components of your meals can sometimes be helpful, and trying to avoid lying down after eating. There are also some things you can do, like wearing loose clothing, using mouthwash, or avoiding smells that seem to trigger nausea. And then again, not a lot of data behind this, but acupuncture and acupressure have anecdotally been helpful to some patients who experience a lot of nausea. I do say this, patients often, or people often use marijuana as a way to manage nausea, but actually marijuana in excess can cause nausea. And so it is just something to be careful of using marijuana in excess in this case. And then medications can be helpful, again, under the direction of your doctor. Acid-reducing medications can sometimes help reduce nausea, and there are anti-nausea medications that can be prescribed by your doctor. Poor sleep, this is one that I think a lot of my patients experience. There's probably many causes of this, but overnight waking for bowel movements or having pain in the middle of the night can wake people up. Some of the medicines we give can cause poor sleep, like steroids. Inflammation itself may affect sleep patterns. We actually have a sleep expert in our audience here, Dr. Camp, who's working at the University of Washington to study sleep in inflammatory bowel disease patients and really understand how the disease itself might affect might affect sleep patterns. Anxiety and stress can sometimes keep us up at night. And it turns out that poor sleep quality can predict a flare. So it is really important that we get healthy sleep. There are some techniques that can be used to help people sleep better. And if you're really having trouble sleeping, I do recommend that you work with a sleep specialist. There is a technique called CBTI that's been shown to be very helpful at kind of reprogramming yourself for sleep. But some of the tenets of this are not forcing yourself to get to sleep, so getting out of bed if you're until you're tired again. Really creating a pattern for yourself where you focus on relaxation in the hour prior to bedtime, a sleep schedule where you're going to bed and waking up at the same time each day and night. They recommend that you actually don't try to sleep in or nap, that you keep the sleep schedule and try not to catch up on sleep to get yourself into a better sleep pattern. Exercise can be very helpful. Caffeine avoidance, especially afternoon, and alcohol avoidance can be helpful to regulating sleep. And then trying not to do anything in the bed other than sleep. So I know myself, I've gotten in bad habits around doing work on the computer and sometimes Netflix in bed. And really trying to preserve bed for sleeping time has been shown to be helpful with sleep. Keeping the room dark. And then again, a sleep journal can be helpful to really understanding the patterns of sleep. And again, this is something that you can work with a sleep specialist on if it really is an issue for you. Another thing kind of related to sleep, but I think deserves a discussion in its own right, is fatigue. This also is probably multifactorial for inflammatory bowel disease and can be related to having active inflammation in the bowel. So again, getting at this root cause. If your body is working overtime on the inflammation that is ongoing, then it doesn't have resources in order to give you the energy you need in other aspects of life. But there are other things that can cause fatigue, so things like having low blood counts, again, that can go along with having active inflammatory bowel disease, certain vitamin deficiencies, sometimes medications can make you tired, anxiety and depression, and this is something we'll talk about a little bit more, so mental health disorders can cause fatigue. And then there are some sleep disorders that one might be tested for, like obstructive sleep apnea. I think as physicians, we don't have lots of tools here to help people with their fatigue. We try to, again, reverse some of the underlying physiology, but I do try to have people increase their physical activity. I find that that helps with both the mental piece of this and can actually, it sounds counterintuitive, but it can kind of create some energy. But I think it is really important to meet yourself where you're at. If you're really, really ill from your inflammatory bowel disease, it may be hard to do a lot of exercise, but even just getting up and walking a little bit every day can be helpful. There are some techniques one can do with a health psychologist, like cognitive behavioral therapy, that can help to address some of the aspects of fatigue, and then really focusing on sleep and relaxation. So I want to take just a minute to talk about mental and emotional health and inflammatory bowel disease. And this is something that's been getting a lot of attention recently. There were a couple of studies that were published in the past year, really bringing to light the issues around mental and emotional health. These are just some of the words patients have used in their own words to talk about how their disease feels: helpless, anxious, frustrated, stressed, isolated, depressed. In these studies, 65% of patients said that their disease controlled their life instead of them controlling their disease. This is pretty profound. About 20% of patients had been diagnosed with anxiety or depression, and only 7% were actually seeing a mental health care professional as part of their inflammatory bowel disease treatment. And only half of patients felt comfortable talking to their doctor about emotional well-being. So again, it's something that can be very hard to talk about, very hard to broach, but I think you can see here is that a lot of people struggle with it, and not a lot of people are getting integrated behavioral health care with their inflammatory bowel disease. Anxiety and depression can actually impact symptoms and disease course. So anxiety and depression are associated with increased disease flare and symptoms. And it's hard to know whether this is chicken or egg, right? Obviously, when you're not feeling well physically, it's hard to feel well mentally. Patients who have depression and anxiety had decreased consistency taking their medications, which can obviously affect how well the inflammation is controlled. And then anxiety and depression increases the risk of hospitalization and surgery. So these are really important issues to address. Obviously, the first thing is talking to your doctor about them and getting hooked up with a mental health care professional. It's really important, even if you don't identify as someone who has a mental health disorder like anxiety or depression, it can be really helpful to manage stress, because I think most people who deal with a chronic illness like inflammatory bowel disease do feel some degree of stress. And if you don't feel comfortable talking to a mental health care professional about it, talk to your peers, talk to friends, support groups, coaches can be quite helpful. What I talk to my patients about are a number of different techniques that one can use to try to reduce stress associated with having chronic illness. So mindfulness can be quite helpful, and this is really just the process of focusing on the current moment and where you are. It can look very different for different people, but for some people this looks like meditation or yoga or just breath work, deep breathing and focusing on your breath. It could just look like sitting and doing nothing and turning off all of your electronics. And then there are some other techniques like EFT or tapping, which can be quite helpful. Again, there are a variety of ways to do this. There are now a variety of apps available on your phone that can guide you through some of these techniques that make it very easy to try some of these out. And the way that we think mindfulness works is that it keeps you in the present moment. So it reduces the future focus, and it can reduce some of the catastrophizing that can happen. So it's very easy to kind of go to the future place of what will happen if I don't get better, or is some terrible thing going to happen to me related to my disease? And what mindfulness does is it really just keeps you centered in the present moment. There are some forms of therapy that can also be very helpful. So acceptance and commitment therapy is a therapy that works on dropping resistance to having a chronic illness, and then committing yourself towards doing things that will move you forward and make you feel better. And in a study of patients with inflammatory bowel disease that was published a couple of years ago, patients had about a third reduction in stress with this technique, with this psychologic technique. I think other things that can be helpful are processing emotions and just kind of connecting to the body. And again, when I talk about becoming an expert in your own body, this is really also an expert in the emotional aspects of your body and what's happening with your emotions in relationship to your disease. And then lastly, I think pain and discomfort can be something that is quite present in patients who have inflammatory bowel disease. Again, we want to know why, so we're going to be working with your doctor to really understand that. I think we've learned over the past many years that opiates for chronic pain are probably not a good idea, especially for patients with inflammatory bowel disease. Studies have actually shown that it ultimately leads to poorer control of pain, and for patients with Crohn's disease, there can be an increased risk of death in patients on chronic narcotics, so we really try to avoid these medications. Non-steroidal anti-inflammatories also, so this is like ibuprofen, Advil, aspirin, Aleve, we try to avoid frequently, although probably in small doses they are okay to take. So these are a lot of things that we try not to use. We don't have lots of data on what is good to use, but sometimes some of the neuromodulators like gabapentin or low-dose antidepressants can be used. And I think this is really where we are in an experimental phase. But I think what we're finding is that mind-body interventions may be a very important place, or may have a very important place in helping patients to manage pain. So this is a quote from a patient with Crohn's disease who says, "My pain is exhausting, and it's rarely just pain. It's joined by a spiral of anxious thoughts about what the pain means." And I don't know if anybody can identify with this, but I think one common aspect to the pain that can happen with inflammatory bowel disease is it does create a lot of anxiety, and that anxiety then can feed on the pain and make the experience of the pain even worse. And again, although we don't have a lot of data on this, on the mind-body interventions, we're starting to gather this, looking at techniques that can be done with a health psychologist, like cognitive behavioral therapy, GI hypnosis, acupuncture, mindfulness, somatic tracking. These are all techniques that can be used to try to reduce pain and especially to interrupt this pain anxiety cycle. So I'm going to stop there. I'm just going to leave some resources up. I will give you these slides so you have them available. But these are resources just to help you build a team of people around you if you're interested. Some resources in terms of where you might get some help finding a mental health practitioner, a dietitian, some apps that are available to try out for mindfulness techniques. And then again, there's a bunch of disease management apps that have different aspects related to them, but may again help fill out that team of people around you to help manage your symptoms. Thank you.